So good afternoon, everyone. I'm going to be talking today about our work at the Rudd Center on monitoring and evaluating food industry marketing to children and adolescents. One of the questions that I was asked to answer is who should be responsible for monitoring progress. And I'm going to make a pitch for independent academic organizations like the Rudd Center and others who do this work. For a couple of reasons. First of all, what we do is based on scientific methods, so it's very important that we use the most rigorous science available and we are completely transparent in what we do. So you can go to any of our reports and see exactly what methods we used. You may not agree with them, but they're out there and we're happy to discuss them. Another benefit that we have is that we can name names. Now, the FTC has done some wonderful, very important work, subpoenaing records from food companies, and that's invaluable to us. But they can't say what the individual companies are doing. And what we found is that when you start naming names, companies pay attention and they start changing their practices. So in our work, we have a number of objectives. First of all, we want to identify what marketing practices are going on. And you saw this morning, there's a lot going on, and most parents are not aware of how companies market to their children now. So that's a main goal of our research, is to find out what's happening and then publicize it. We also want to monitor progress, so we want to see what's changing over time. And we want to encourage changes that improve the diets of children and adolescents. And so it's very important for us that we say when something is happening that's positive. And the CFBAI has mentioned our research in their work, which we find very flattering, that we find progress and they acknowledge our research. But I'm going to give you a couple of examples why we think that independent monitoring is so important. First of all, one example is the Grocery Manufacturers Association in 2011 issued a press release, and Georgetown Economic Services had done a study where they found that the number of food and beverage advertisements on children's television fell by 50% from 2004 to 2010. Now, we haven't been able to get a copy of that report, so we're not exactly sure how they came to that conclusion, but we do have access to the Nielsen data that they use. Oops, sorry, I went backwards. And so what we found when we've been tracking children's exposure to television food advertising over time is, first of all, if you look at the yellow line, that's the number of ads that children see every year. And it peaked in 2004, the number of food ads. And then it declined from 2004 to 2007, stayed relatively flat, and then went up again in 2009 and then went down. So overall, children are exposed to about 2% fewer food ads in 2010 than they were in 2004. This is all the food advertising they're exposed to. The other important thing to look at in this chart is the blue line, which is adolescent exposure. And what you see there is from 2007 to 2010, adolescent exposure to food advertising increased by 23%. Now, there's not a solid line between ads that kids see and ads that adolescents see. And so because of that increase for that elder age group, children, it basically offset the reduction in advertising in children's media. CocaCola last year came out with a statement that 2/3 of their spending is on light or low-calorie products. Again, we don't know how they came to that number, but we do have Nielsen data on media spending. And this is a very complicated chart, but what we did is we looked at Coke's advertised brands, and there were 7 regular sodas that they advertised and 27 of all their other products. So diet sodas, plain waters, iced teas, juice drinks, vitamin water, sports drinks, energy drinks. And they spent about 151 million advertising their regular soda products, which most of that was for their Coca-Cola classic brand, and 202 on these other 27 different products. Now that doesn't quite add up to 1/3, 2/3, but we decided to dig a little bit further, and we added in the brand ads. So these are, as Jerome mentioned today, the ads that Coca-Cola places mostly for My Coke Rewards. So they don't talk about a specific product, but they talk about their brand. And when we did that, we got about that 1/3, 2/3 number that Coke was talking about. Another question that I was asked to answer is, what would progress look like to us, to the public health community? And I think this is one area where we have a fundamental disagreement with the CFBAI, is that we do want to see reduced exposure to marketing for calorie-dense, nutrient-poor foods. We don't understand how we can solve the obesity epidemic when children continue to see such enormous numbers of ads for unhealthy food. We want to see this in all media, so not just media with 35% child audience. We want to see it in programs like iCarly or Victorious, which are seen by more 12, 13, 14-year-olds, but also large numbers of children. We want to see all forms of marketing. So we also think that packaging, licensed characters on packaging in the supermarket or mobile apps are also an important type of marketing to children that should be reduced. And finally, we want to see it for all youth, not just 2 to 11-year-olds. And one thing that I'd like to say is that the 12 to 14-year-old group is not included in the industry self-regulation, but that age group sees more television than any other age group, so they're exposed to more food ads than any other age group. They also have their own money, so they can go into a corner store or fast food restaurant and purchase these unhealthy products. And I think, someone asked this morning, what would be the most important policy change? That is the one that we would ask for, is that 12 to 14-year-olds be included in the Children's Food and Beverage Advertising Initiative. Another fundamental area where we disagree is that we're not against food marketing per se, but we think that any marketing that's done to kids should promote foods, as the IWG put it, that are desirable to market to children to encourage a healthful diet. And that means foods that are composed primarily of fruits, vegetables, whole grains, low-fat dairy, things that children should be consuming more of, not foods that they should be consuming less of. So in our work to monitor progress, we look at the nutrition of different food products. We also look at the content of the advertising, but I'm going to focus today on our work mostly measuring the quantity of food marketing that young people are exposed to. And we look, in this work, we borrow from my experience in the business industry, where we do a lot to find out what our competitors are doing. So these are the same tactics that we use at the Rudd Center. We use syndicated market research data whenever that's available, ComScore, Nielsen, Arbitron. We use mystery shopping. We go into stores and measure what's going on in the restaurants, on the shelves in the supermarket. And then we do a lot of research on the internet just to see what practices are being used by the different companies. So I'm going to tell you about a couple monitoring studies that we've done in looking at what has happened. Our cereal facts report was a report where we looked at the marketing to children and adolescents of cereals in 2009, the first report, and then we did an update in 2012 to see what had changed. And we did find some, what we think is important changes. I think the biggest thing that happened is that General Mills and Post Foods took down their Millsbury and Postopia Advergame sites. These two sites had been the most visited, well, the Millsbury site had been the most visited Advergame site on the internet. And as you can see, children were spending over 60 minutes on that site every month. So that we think was huge progress. Now, companies have put more effort behind their single brand sites since then, and a lot of those have grown, but you don't see the kinds of numbers that we saw for Millsbury and Postopia. Children's exposure to serial advertising on television also went down by 25%. So in 2006, kids were seeing 2.4 serial ads per day on average. In 2011, they were seeing 1.8 per day. Now that's still the most advertised packaged food on children's television, but it is progress. But the main question that we have is, do their marketing practices now support better diets? And so one thing that we looked at is the nutrition quality of the cereals, of all the companies' cereals, not just the children's cereals. And what we found is that 13 of the 16 cereals that are advertised directly to children did improve. So their sugar went down, their sodium went down, their fiber went up. But on the other hand, child-targeted cereals are still the least nutritious products in the cereal companies' portfolios. So the cereals that are advertised directly to children have 54% more sugar, 52% less fiber, and 50% more sodium than the products that are marketed to adults. And we also distinguished between child-targeted cereals, which are advertised directly to children, and family cereals, which are advertised to parents to serve their children. So there are much healthier products that are advertised to parents, like plain or multigrain Cheerios, Frosted Mini Wheats. Those are healthy products, but they're not marketed to children. So the products that are marketed to children as of the end of 2011 are these 10 products. The best of these has 9 grams of sugar out of a 27-gram serving, so a third sugar, 8 to 12 grams of whole grain, and the rest is simple carbohydrates, which is not much better nutritionally than sugar. And as one of the parents in one of our focus groups said, you know, if this is the better for you list, what's the worst? You know, these are not products that children should be encouraged to consume more. So the cereal companies use fairly traditional marketing practices. They do a lot of television and internet. But I was asked to talk also about more innovative types of marketing practices. And I'm going to pick on CocaCola a little bit. In 2011, they received the award for Marketer of the Year. And as Ad Age said, they're not too big or too staid to innovate. Beverage giant earns top honors. Now, Coca-Cola actually has a very strong CFBAI policy. They've committed that they won't place any brand marketing in television, radio, or print that's primarily directed to children under the age of 12. So none of their products are in children's media. But they've also been very open about the fact that they want to target teens. They see teens as their future business. They can't afford not to talk to teens. Every 6 years, there's a whole new population in the world. So how did they do that? Well, in our Sugary Drink Facts report, we looked at TV ads, product placements, radio company websites, banner ads, social media, and mobile marketing. And Coca-Cola, as well as a few other sugary drinks, were in all those different types of media. On product placements, there were 730 Coke appearances on 429 telecasts, lasting about 14 seconds. So their product placements lasted almost as long as a 15-second commercial. And in fact, children and teens saw more product placements for Coca-Cola than they saw TV advertisements. So it's a huge marketing program for them. They have company websites. Now, these aren't child-directed websites. As you can see, 12 to 17-year-old visitors are much higher than child visitors. But the biggest website is My Coke Rewards, which is a usage site. So you collect the bottle caps and you go onto the site and you can get lots of cool stuff. There were a lot of banner advertising on third-party websites. Again, the My Coke Rewards, almost 500 million banner ad impressions per month for that website. And I'm just going to show you an example of one of their banner ads. One thing a lot of people don't realize is how engaging and interactive these banner ads are. So this is wish studying was more fun. Use the CocaCola Grammar Keeper. Turn your tunes into catchy turn your notes into catchy tunes. Basically, you can read your notes and it makes a song out of them. Social media, this was in 2010, 30 million Facebook fans. Now it's more than 50, 300,000 Twitter followers, 23 million YouTube uploads. These two mobile apps were downloaded by 40,000 teens. So one's a spin the Coke bottle app, and the other is a magic Coke bottle app. And this was 25 to 40% of their users. They placed banner ads on 61 different sites. You can sign up to receive text messages if you want to make your bottle caps even more, get you even more stuff. You can get these special rewards through text messages. So what we did was we added up exposure to all of these different kinds of media that we could measure. And not surprisingly, Coke had more ads than any other, or teens saw more ads for Coke than any of the other sugary drink brands. But if you look at children, 2 to 11-year-olds, they also saw more ads for Coke than even Kool-Aid or Capri Sun that were targeted directly to them. So this overlap between the media that children and teens are viewing is very important. I'd just like to end with this quote from the White House asking for the food industry and the media industry, as well as government, food retailers, trade associations, to support parents and create an environment that encourages healthy eating. And we also did a report that just came out last week showing that the majority of parents think that the food industry is having a negative effect on their children's eating habits. So this is an important measure. And I'd like to thank the Robert Wood Johnson Foundation, who funds our work.